and good morning. I'm Dr. Deuk Majan. We're here at the Deuk Spine Institute. Our patient has facet pain, facet, F-A-C-E-T pain, and Henry is going to show you a video of thoracic facet pain. He started having symptoms when he fractured his T6 vertebral body. Can you guys see the x-ray, Henry?
Yes, we can.
Shot. And you can see the white arrow, pointing at T6. That is cement in his T6 fracture. That was done here. But that didn't end his pain. He had more pain afterwards, and the pain that he had afterwards was in the facet joints. He had a medial branch block done, which was successful, but it didn't get rid of his pain permanently, because medial branch block is a diagnostic injection of numbing medicine that wears off in a few hours. Have you injected? So we're going to start by treating his facets here up to T4. Let's go ahead and we're going to make our first incision while Henry shows you guys while Henry shows you guys where how the facet joints can cause so much pain. Right there.
Facet joint injury is a common cause of chronic thoracic back pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, you've had an opportunity now to see how facet joints can become painful. Let me know, Dr. B. And they become painful when we injure them. We injure them through trauma, some type of an accident, a fall or car accident, where your spine suddenly wrenches or twists and you put a lot of stress or force on the joints between the bones, and that causes those joints to fail. The capsule around the joint fails and it tears. Once it tears, a cycle of inflammation in the tear sets up, and it just causes horrific pain with any kind of movement. And that's what this patient has. Sean, any questions so far from our audience?
At this moment, no current questions.
All right, so we're targeting the, and if you look at that x-ray, the tip of my probe is in the perfect position. If you follow the transverse process of the thoracic vertebrae there, you go to the top of it, and you come in towards the facet right there. There's a little valley, and that valley is exactly what we want. How are we doing, Dr. B? That valley is where the pain nerve lives, and once we destroy the pain nerve there, then the patient's facet pain goes away. Shot. Medial inferior. Shot. That looks good to me. What about you?
Yes, sir.
pressure. Okay. So, you got pressure? Keep it there. Ready? Move your hand. Shot. That looks pretty good right there. Maybe a little bit lower. Right around there. Shot. That looks pretty good. Right in the middle. Now, any questions from our audience?
At this moment, no current questions.
Are we back?
Yeah, we're back and we're streaming. We got a crowd.
So once again, the target for facet pain is something called the medial branch of the dorsal ramus. It's a small nerve, and it's a nerve that does one thing and one thing only. It transmits pain from a arthritic joint, facet joint, up to your brain, so your brain can know that joint hurts. And I wasn't the first person in the world to start treating painful facets. That was done a long time ago by people much smarter than me. And the facets used to be treated by a procedure called fusion. When you had painful facets, we would fuse the spine, and that would get rid of the pain. Berndes. Come on. Shot? I don't know. What do you think? Okay. Shot? What are all those wires there? Can you move those out of the way? You see him? He's probably laying on them. Any questions while we're moving these wires?
At this moment, no current questions.
I think my tip looks really in good position. No. All right, so I'll keep working on the patient's right side, and we're just going to keep working our way down. What are those wires, guys? Got it. Well, we can't move those. Shot? All right. Any questions from the audience?
At this moment, no current questions.
Well, let's run our video one more time for those who kind of came in late. And how do thoracic facets cause so much pain? And how do we get rid of that pain?
Of course.
Facet joint injury is a common cause of chronic thoracic back pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
And welcome back. We just reran our animation video on the Deuk plasma rhizotomy, Sean, just for those of you who sort of missed it earlier. But basically we're in the process of destroying pain nerves that cause pain, chronic pain that patients otherwise would never be able to get rid of. And this procedure you're watching is the first of its kind. It was developed here at Deuk Spine. I'm the one who developed it and pioneered it and patented it. So this is a patented procedure you're watching. It is completely FDA approved. It uses only FDA approved equipment and supplies, and it's a very safe procedure when done properly trained. As most of you know, I'm a neurosurgeon, so I've been trained on spine surgery techniques, and we've been performing this procedure now for over 5 years. Right, Luis? Successfully. We've gotten 100% pain relief, and our patients never come back for the same problem. They may come back for different problem. For example, the last surgery we just did, that patient from California, she had surgery here before, but it was for something else. And now we're treating her disc. So our patients know to come to Deuk Spine when they have problems, Sean. They don't go elsewhere because they trust us. They know we have the best treatment in the world right here at Deuk Spine for their spine. Sean, any questions?
No current questions. So we do have a comment coming from Chino on X or Twitter
Hi, Chino on X Twitter.
saying, wow, it's only a 30-minute surgery.
Yeah, it's incredible, isn't it, Chino? This procedure you're watching right now is a permanent treatment for facet pain, and it takes 30 minutes. Now this patient has many levels being treated, right? Far more than most patients. Most patients have 1 or 2 or 3, but this patient's having how many now? T4, 5, 5, 6, 6, 7, 14 levels. So it's a big like number of levels being treated, but it does take about 30 minutes to do everything. All right. Let me see. Yeah, I think I want to try to get one more down. 7, 8, 9, 10. Because his worst pain is in this area that we're in right now, and the one we were in just a minute ago. And I want to make sure that we get everything we can to give him the best result possible. I think I can get one more level here. Any questions?
At this moment, no current questions.
Shot? Shot? A little bit too lateral. Again, this is a permanent RFA. You may have heard of RFA before. RFAs are temporary. This is the only permanent in the world. I pioneered it here at Deuk Spine. And I did it because I saw so many patients, they just kept coming back with the RFAs because the RFAs would wear off. They'd stop working. So the patients kept coming back and getting more RFAs. When I asked why, my partner, he said, oh, yeah, they just don't last. I'm like, why not? I mean, I understand the concept here. you're trying to destroy a nerve that's a pain nerve, but why does the pain keep coming back? I mean, why can't you permanently destroy the nerve? And the answer was, I don't know. So I developed a way to permanently destroy the pain nerve. And I was the first in the world to do it, so we patented it. The numbing, you have num num? Did we already do num num? I'm going to do a little more. Make him comfortable. After all, he does have a pacemaker. So keeping his heart happy is going to be important. Right, Dr. B? I knew I wouldn't get any disagreement from you. Right? Num num's a good thing. Any questions from our audience?
At this moment, no current questions.
Num num makes the world go round. We started on the patient's left-sided thoracic facets. Sorry, yeah, his left. And we've already done the right. Now we're doing the left. Hold on, Jordan. You can see, Shot, that we use an X-ray machine. That's 2 medial. And the X-ray machine is guiding me to place my probe tip exactly where it needs to be to perform the rhizotomy. But it also allows me to do something called localization. And in surgery, localization means getting to the proper location. You're using image guidance or sometimes your own eyes to navigate, sorry, not navigate, but to identify your target, right? So as a surgeon, I have to find the target. Where am I operating? What am I operating on? Where is it in the body? And we as surgeons use X-rays all the time to navigate, especially in spine surgery, because spine surgery, the spine is made up of bones, right, Sean? So you use the X-ray machine to navigate. Does that look pretty good? Maybe a little more lateral? Sean? And I'm just talking to Jordan here, who's helping me. Jordan is our X-ray technician, and he has many other hats that he wears. He helps out with prepping the operating rooms and turning over the ORs and running the surgery center. He helps Luis with that. Many of you know Luis from being in the operating room with me, but Luis also runs our center along with Jordan's help and a few other people. All right. Any questions?
Yes, we have 2 questions.
Hold on, Sean. Go ahead.
First one coming from Sandy on YouTube, asking, I have 2 severely impinged nerves in my lumbar region. Would this procedure help with my pain?
Yes. This procedure will not help with pinched nerves. You need the Deuk laser disc repair. But if you have painful facet joints, this procedure is the best treatment in the world. So it really just depends on the source of your pain. And I need to do a quick MRI review with you to figure that out. Okay? So you got to schedule a quick MRI review.
The next question is coming from Chino, once more on Twitter, asking, what type of surgery
Sean?
is this one?
This is a minimally invasive procedure that's done to get rid of pain in the spine, specifically thoracic pain. So one of the most common causes of pain in the body is spine pain, pain from your spine, and this procedure eliminates thoracic spine pain that comes from something called the facet joint. And this patient injured his facet joint in his thoracic spine, many of them actually, more than one, through some type of a traumatic injury. It could have been a fall or a car accident. We don't know everybody's story, like what caused their injury to their facet joint, but we do know that his pain is coming from his facet joints. And how do we know that? Well, he actually came in last week and had a medial branch block, which is a diagnostic test. done to figure out where someone's pain is coming from. Is it coming from the facet joint? And his answer was yes. His pain was definitely coming from his facet joint. So he then wanted to schedule his procedure today to get his pain from his facet joints eliminated. And you guys just watched the video on how we do that, right? And the way we do it is by going in and burning pain nerves, basically, and cutting these pain nerves. And most doctors do what's called an RFA, but we learned that RFAs are temporary at best, and a lot of times they don't work at all. Shot. And so we developed at Deuk Spine a new treatment that is a permanent fix for this type of pain. It gets rid of this pain permanently. And it's called the Deuk plasma rhizotomy. We call it the Deuk plasma rhizotomy, and it's actually patented. A few minutes left. Sean?
No current questions, so we do have a comment from Chino once more on Twitter saying thank you for the
Hold
answer.
on. Yeah. So I think we're off a little, Jordan. Can you adjust the X-ray, because there's some scoliosis here, and I need to get that pedicle lined up properly. Sorry, other way. I'll take the comment from Chino in just a moment. That looks pretty good. Man, can you get that pedicle lined up better right where I'm at? I think it's not bad, but it could be just a tiny bit better. Tiny bit. All right, sorry, you take the comment from Chino.
He was
That
just
looks
saying
good,
thank you for
thanks.
the answer.
All right, so show the audience with the arrow, Jordan, where the pedicle is I'm talking about. There it is, a big circle right there. You guys see the circle? It's like an oval, like an egg on its side.
Yes, we do.
And then you got the top of the vertebral body, which is that black line right there, goes all the way across to the other side. Then you got the bottom of the vertebral body. Show them the bottom, yep. And then show them the disc space right there next to the bottom of the vertebral body. There's the disc. Show them the disc above. There's the disc above. So the hardest thing to do is figure out, is the patient's pain disc or facet or both? In this case, we know for sure he has facet pain, so we're starting to treat that. And then where I want to do my burn is right at the top corner of that pedicle and where it meets the transverse process. So you guys see that there's like a little bone right there. It's called the transverse process. Outline the transverse process for them. Now the transverse process articulates with the rib, and you can see that articulation right there, that two black lines right there. Yep, that's the articulation with the rib. So if you follow the TP back to the pedicle, right there where the arrow is, that's right where my probe is. That's exactly where the pain nerve is supposed to be. Okay, and that's why I'm burning right there. I just felt the pain nerve get cut exactly right where I showed you where it is. So that was a big pain nerve. Now, by the way, that big pain nerve right there is dead center for where he said the worst pain is. So I actually just treated the worst one, okay? Now I'm going to go down to the next level and see if I can't get there from here. And if I can, great. If I can't, then I'll just have to reset. Yep, perfect. See where the tip is? It is literally in the perfect spot where the pain nerve is. It doesn't get any better than that. So that's why we use X-ray guidance, folks, because the landmarks for this procedure are best seen on X-ray. As a matter of fact, they're best seen on AP X-ray. AP means front back. Shot. Let's see. That's to medial. All right. So I got one more incision I'm going to make and one more burn set. And let's just staple it. Oh, okay, fine. We'll make the last incision. So these incisions I'm making are 4 millimeters. That's tiny. Very, very small. There's no bleeding. I mean, literally 1 drop of blood. So when I say no bleeding, I mean relative to open spine surgery, there's no bleeding, but there's like 1 drop of blood, so it's not much. Any questions?
Yes, we have a question coming from Pawn Lust on YouTube.
Sure.
Asking, have you ever considered this procedure for uncomfortable cervical spine joints, or does it not really make sense? I'm not sure if it can directly cause pain.
Yeah, this procedure is done for cervical uncovertebral. The uncovertebral joint, there is no pain from uncovertebral joints, okay? But the pain in the cervical spine comes from what's next to the uncovertebral joint, which is the facet joint. And we use this for those facet joints, right? So it is used for the cervical spine. But uncovertebral joints never cause pain. They're not true joints. They're not diarthrodial joints that have a synovial membrane. They're just fake joints. All right. I think we're done here. And if there's no other questions, thanks for joining us. We do have one more procedure. It is a patient from California who has piriformis syndrome. He's got a torn muscle in his right buttock, so we're going to do a piriformis muscle release. Stapler. And just take a look. You guys can see these incisions. They're tiny. They're 4 millimeters each one. And the patient will have soreness in his muscles for a couple of days. And then he may have some numbness of the skin here, which typically happens about 20% of the patients. But yeah, this is a permanent fix. Tiny little incision. Thanks for joining us. No other questions. We'll end our stream.
We have just a comment coming from Chino once more on YouTube saying, I have facet joint, but mild, but sometimes I can't sleep. I wake up with numbness.
Yeah, I don't know if the numbness is coming from your facet joint. Facet joint problems only cause pain in the back, lower back or neck or thoracic, but numbness means you have a pinched nerve. So what you should do is get an MRI, submit it to our website, mri.deukspine.com, and you will meet with me and I'll diagnose your problem and tell you exactly what it is. More importantly, I will tell you how to fix it. And that consultation is free and it's done by Zoom. You don't even have to come to our office. We do it over Zoom.
And no current comments or questions.
Thanks for joining us. We'll be back in 20 minutes for a